Here at the Department of Public Health, we set out towards a collaborative effort between public health professionals, researchers, scientists, doctors, nurses, and other staff that are dedicated to public service and improving and protecting the health and well-being of community members. Some of our main goals include preventing disease and injury, promoting good health and healthy lifestyles, providing safe and healthy environments, and overall encouraging positive health outcomes. We also understand the importance of health equity and attempt to reduce health disparities by fostering policies and programs that promote fairness, social justice, equity, and cultural competence. Some of our key stakeholders include the Los Angeles County Board of Supervisors, the LA County Health Agency, and various other agencies who advocate, help fund, and work with us here at the Department of Public Health, including the Center of Disease Control and Prevention, the Department of Health Services, and the United States Department of Health and Human Services. But of course, our fundamental stakeholders are the members of the general public. Serving over 10 million residents through our 39 programs and 14 public health centers, the LA County Department of Public Health aims to implement a variety of programs and services in collaboration with local health departments and state, federal, and private partners to improve public health and the well-being of the community members. In our vision of promoting overall well-being for those in the community, DPH has developed a key focus on substance use and abuse and its contribution to the U.S. drug problem. In 2017, California alone had the fourth highest number of drug overdose deaths in the nation, with 4,868 fatalities related to opioid use. Not only has substance abuse brought about premature deaths, but it increases the risk of infections and illnesses such as HIV, hepatitis C virus, and reduced skin and soft tissue infection. Substance use can also have a multitude of other effects on physical health and mental well-being, which can lead to societal harms and affect various aspects of life. Studies have shown that chronic users are less likely to be employed, finish school, and are more likely to engage in crime, and therefore it is crucial that we prevent and intervene at an early stage. That is why the Department of Public Health seeks to remove the stigma from substance use and address it as a disorder that can be prevented and treated, rather than criminalizing the individual user, like society has done many times in the past. With that being said, we need to address policies, such as the war on drugs, that has failed to work and has negatively impacted minority communities. The war on drugs profoundly contributed to a culture where African Americans are overrepresented in the penal system, and minority groups as a whole have been disproportionately treated as a result of such drug policies. Introduced by President Richard Nixon as a tactic to boost his campaign during the 1960 heroin epidemic, he declared a war on drugs, classifying drugs as public enemy number one and promising to alleviate crime related to drug use. This tactic demonized drug users and took a tough approach on drugs and crime while emphasizing drug enforcement. This led to the foundation of the Drug Enforcement Agency, also known as the DEA, and brought about the reinstatement of mandatory minimum sentencing guidelines. As a result of this stringent approach and emphasis on drug enforcement, this created a surge in incarceration rates and brought about wide racial disparities in the penal system, incarcerating African Americans at a rate 6 times greater than whites for drug-related crimes. As this policy carried on into the Reagan administration, the incarceration rates and harsh treatment towards minorities continued to grow as police gained more power. Despite failing to meet its goals of increasing the street value of drugs and intercepting drug supplies, more funding was put towards the war on drugs effort, with 65% of the federal drug policy budget being spent on enforcement strategies. This increase of funding to help support the war on drugs gave police officers extreme power and access to militarized weapons, later leading to the development of specialized weapon and tactic teams in many local police departments. The continued emphasis on enforcement of drug use amplified the presence of raids and stop-and-frisk tactics in many Black and Latino communities. Such tactics have contributed to negative health outcomes due to psychological, physical, sexual, and neglectful violence that they have brought upon minority communities due to the war on drugs policy. Motivated to address the racial disparities in drug sentencing law outcomes, President Barack Obama implemented the Affordable Care Act in 2016, making it mandatory for U.S. citizens to hold medical insurance, Meanwhile, prioritizing affordable health care and classifying drug addiction as an illness that medical insurance should financially cover. This provided a financial stream that made it easier to obtain drug treatment and provided health care and substance abuse assistance to millions. Although little progress was made due to government roadblocks, this initiative changed the climate regarding drug use and drug offenders, shifting the outlook on drugs from being evil and hellish to drug users and drug offenders suffering a chronic medical disease that can be treated through prevention and treatment interventions rather than solely enforcement. By viewing the drug problem as an illness, preventive strategies can be implemented to address substance abuse at early onset. Past research has revealed that delaying the age in which a substance is initiated can have a large effect on the probability of one becoming dependent upon substances and impact the duration in which the drug is used. Early drug use can increase the risk of serious mental illness, contribute to poor school outcomes, increase drug dependency, and there are mixed results that it can also lead to adult poverty. Therefore, programs that delay the initiation of drug use have the potential to reduce subsequent dependence on substances, which can help promote healthy outcomes that can influence education and job experiences and opportunities. Typically, prevention programs can be divided into 3 categories: universal, for the general public; selective, for those at risk or just beginning to use; and indicated prevention, which is for those already using. Such prevention programs can be additionally divided in context of how they are provided, such as school-based prevention, family-based prevention, and community-based prevention. Each takes a different approach, but overall focus on preventing early drug use. School-based programs can be delivered in various ways, such as providing information to youth about the harms of substance use in order to deter them, taking a skill-building approach that helps them understand social influences and learning how to respond to different situations, including resistance training, and through normative education that helps change the perceptions about substance use norms and is typically taught by police officers, trained health educators, or teachers. Although there is no evidence to suggest that these types of programs have long-term effects, they have shown some success in delaying the initiation of substance use. Family-based preventions target families with a child or parent who is currently using drugs or at high risk of doing so. These programs typically involve an intervention ranging from psychotherapy to programs intended to improve the family communication and promote discussions around the substance use and its consequences. Such programs include the Preparing for the Drug-Free Years and the Focus on the Family program. Community prevention programs tend to target specific populations within communities that may be high risk for drug use and abuse by offering services like drug education, treatment diversion programs, and boot camps. Such programs are not necessarily prevention strategies, but aim to prevent access to drugs. Mentor programs like Big Brothers and Sisters falls into this category and have shown success in their approach to promote healthy relationships and outcomes by providing positive role models to disadvantaged youth. Studies have identified prevention programs that incorporate skill building to be most effective. This approach can also be taken when addressing substance use among current drug users as well. By providing drug education and skill-building programs, drug use and the adverse health outcomes that come with it can drastically be impacted. Taking such an approach, the Supervised Injection Facility in Vancouver, Canada, suggests that a harm reduction approach can be both cost-effective and produce improved health outcomes. Drugs that are injected, such as heroin, have become a huge concern of the Department of Public Health. Being that needles are typically difficult to obtain, people who inject drugs commonly resort to sharing needles and often use them in unsterilized environments. As a result of this lack of sanitation, various health concerns arise, such as the risk of HIV, hepatitis C virus, and skin and soft tissue infection. Although people who inject drugs make up less than 1% of the U.S. population, they experience roughly 56% of new hepatitis C virus infections and 11% of new HIV infections. The establishment of supervised injection facilities takes a harm reduction approach at reducing these adverse health outcomes and potentially saving lives. Such facilities provide a safe, sanitary setting and clean injection equipment so that people who inject drugs can bring their previously obtained drugs and inject themselves in the presence of medical staff. This helps prevent the user from needle sharing, as well as provides them with education about drug use and how unsanitary conditions can result in HIV and HCV transmission. Along with sterile equipment, clients are supplied with medical staff, advice, and medical wound care to help reduce the prevalence of skin and soft tissue infections. Results of the supervised injection facility have shown to reduce infection, prevent overdose, and also increase treatment uptake by providing more opportunities to seek assistance. Staff of such facilities provides clients with education that has been suggested to help change clients' behavior outside of the facility and creates a trusting relationship that makes it easier for the client to receive help and accept referral to medical-assisted treatments, which have also shown success at decreasing the use of heroin and other drugs. Taking a similar approach to medical-assisted treatment, heroin-assisted treatment also aims to reduce heroin use, targeting problematic opioid users who have not benefited or do not have tolerance to other opioid treatment interventions, such as methadone maintenance treatment. Heroin-assisted treatment includes the prescription of semi-synthetic heroin to opioid addicts who are high-risk heroin users and have not benefited from existing treatment options. Studies of heroin-assisted treatment have demonstrated that it is a feasible, effective, and safe therapeutic intervention that produces rather positive outcomes. Despite positive results in several contexts, many policymakers have been hesitant to adopt this as a regular part of the therapeutic option landscape for heroin addiction treatment. It is also very unlikely to receive federal funding for such treatments due to the uncertain status under the federal law, regardless of its prevention benefits that align with the priorities of the National Institute of Drug Abuse and the White House's National HIV and AIDS strategy. To receive federal funding, we would have to address the current federal laws regarding opioids, an approach that Portugal was willing to accept. Taking this approach and treating substance use as an illness, Portugal established a highly effective policy that has proven to decrease narcotic drugs, psychotropic substance usage, and has led to the decrease in HIV and AIDS in drug users. Implemented in July 2001, Portugal decriminalized the consumption, acquisition, and the possession for personal use of narcotic drugs and psychotropic substances, defining personal use as not exceeding the average quantity that an average individual consumes over a 10-day period. Taking this approach did not legalize narcotic drugs and psychotropic substances, but rather sanctioned the individual with administrative fines after an administrative infringement proceeding. The fines themselves are fairly light and reasonable in regards to the minimum wage of residents and only instated under certain circumstances. This drug policy places the drug user in front of a committee tasked with the mission to help the user with their possible drug addiction. From the hearing, the committee is to determine if the individual does in fact suffer from a drug problem, and if it is believed that they do, the committee refers the user to seek medical treatment, of which they can accept at their own free will. If the individual does not show any evidence of a drug problem or previous history of drug use, they are typically fined for the offense. As a result of this approach, the number of drug users seeking assistance increased, while narcotic drugs and psychotropic substance usage decreased. This specific policy emphasized that the user is not a criminal, but a citizen who suffers from an illness and that must be helped. Taking this public health approach, it is encouraged that rational policy decisions be enacted that produce the least amount of harm for people and their communities to ensure public health and promote healthy outcomes for individuals in the communities and their families.